What doctors aren't telling you about healing pain. Holy poop! I looked up from what I was doing and said, "Everything okay?" "How long do these injections normally take to have an effect?" "Oh, often within seconds. Is it feeling better?" A patient had been suffering from sore joints in his feet. I suggested we try an injection-based therapy to help the tissues function better. It was after I completed the injection on the right foot that he exclaimed what he exclaimed. And P.S., he didn't say poop, he said something else. By the time I started to administer the treatment on the left foot, he was already noticing profound changes on that first side. Needless to say, he was feeling better. The final time I saw him was after 4 of these treatments, and he had regained full mobility in his feet and ankles. He was able to run and hike and climb mountains and play with his dog and get up and down from the floor with ease. Things had improved dramatically. I have a lot of healing tools in my toolkit/medicine bag. I don't usually talk about the tools of my medicine because they can be boring and technical. And think about it like this. When you go to the car mechanic, you don't say, "Excuse me, Mr. Car Mechanic, which wrench are you using to fix my car?" No, you're just like, "Can you get it running again?" In a lot of ways, the tools are less relevant than the result. The underlying principle is the same though. We need to stimulate healing by getting nutrients to tissues and wastes away from tissues and out of the body. The formula for health: nutrients in and wastes out. Some of my tools in my naturopathic toolkit include how to eat healthfully for their individual specific biochemistry, how to move their bodies, so using exercise, stress reduction, herbal medicine, my herbal allies, I love them, mind-body healing techniques to shift people out of old belief systems and patterns so that they're primed neurologically and emotionally to want to take care of themselves and build habits easily, and injection therapies. But here's what doctors aren't telling you about healing pain. Pain is commonly a result of poor circulation, poor nutrient delivery, and poor toxin removal. Yes, we are back at the formula for health again. It applies to everything that we're wanting to shift in terms of our health and our well-being. There's a whole study of natural remedies that is under the heading of what we call drainage. Drainage helps us do the wastes out part. In injured tissue, in wounds, in chronic inflammation, there is a toxic buildup of waste products that aren't getting released effectively because of the poor circulation and the poor lymph drainage. Drainage remedies can be taken orally, applied topically, or injected into the tissues. And I'm assuming that you can appreciate and expect my take on this. The more direct we can be with these types of remedies, the better the impact is going to be, especially when it comes to musculoskeletal issues, whether they be old, residual pain patterns from, say, a motor vehicle accident 2 decades ago, or a more acute injury from, say, a fall or a tumble, or just chronic inflammation that is degrading the tissues and creating a very uncomfortable day-to-day experience. What I'm doing with these musculoskeletal repair injections, sometimes also called neural therapy, sometimes also called biopuncture, is injecting 2 things into the top layer of the skin, subcutaneously or intradermally, a little bit deeper down, or into the muscles. I'm injecting some sort of local anesthetic, Procaine or lidocaine, which immediately are going to have a numbing sensation in the area, which is what the guy was initially experiencing when he said, "Holy poop," except he said something different. I'm also injecting, in combination with the local anesthetic, a combination of remedies designed to drain specific tissue types. So for example, I have a remedy that is a combination of herbal medicines that drains the lymphatic system, another one that drains soft tissues, another one that does joints, another one that does nerves, etc. So these remedies get injected in under the skin, And within minutes, that anesthetic does its job of numbing the area. And I think of this like a Trojan horse. Because even though I don't believe your pain experience is all in your head, it's real, it's not something you're making up. At the same time, a lot of it is in your head, and this is just true neurologically. This is not a judgment that I think you're crazy. No, your brain holds the map of your pain, and it remembers it, and it programs it, and it almost becomes a habit. Just like the first thing you do when you get up is go to the bathroom, and maybe you have a holy poop. We know that imaging studies that show lesions or injuries in the musculoskeletal system do not necessarily relate to pain experiences, and vice versa. Pain experiences do not correlate necessarily to lesions that we can find in the body. This is a paradigm shift that I invite you to take on board because it will help you heal if you are struggling with any kind of persistent pain syndrome. You take 100 people and give them all of the imaging studies known to conventional medical science. They're riddled with problems in their bodies from an image perspective. They have zero pain in their lives. Vice versa, you take another 100 people, do all those same tests. They have no lesions whatsoever, and these people are experiencing chronic, persistent daily pain patterns. Modern pain science and studies show us that we cannot correlate imaging and injuries to pain experience. There's too much going on neurologically and psychologically for there to be a direct link. So the anesthetic goes in and it interrupts the signal from the periphery, the edges, the tissues to the brain. The brain thinks, oh, there's no pain signals coming. I don't have to be in pain anymore. And suddenly there's this window of opportunity that opens up in the unconscious mind's imagination where now it can hold the possibility that it is an okay thing to be pain-free. This is benefit number one. We interrupt the pain cycle and create a psychological, neurological possibility that didn't exist before, or maybe hasn't existed for quite a number of years. Meanwhile, these drainage remedies are going in and scrubbing out the tissues. They're delivering nutrients to the area through the increase of blood flow. They're carrying waste away from the area so that the tissue can actually repair itself without being burdened by not having anywhere to put the garbage. Think of it like this. Say it's garbage day and you have to take the garbage out to the street so that the city can come and pick it up and take it away. And when you try to open your front door, your porch is covered in garbage. And so now you have to clean off the porch to get to the path, but the path is also covered in garbage. So now you have to clean off the path before you can make your way to the street. And that's the same with what's going on in these persistent pain patterns. That's my analogy, my perspective on what's happening. So anesthetic, brain says, oh, we can be pain-free. Meanwhile, remedies are going scrub, scrub, scrub. Let's clean the hallway. Let's clean the pathway. Let's clean the porch off so that we can get this garbage out. And it's amazing how people respond to these remedies because the most common person who's coming in for these types of remedies is the person who sees the massage therapist, the chiropractor, the acupuncturist, the physio every week. And yet they still have these pain patterns existing for them. And maybe they have half a day of relief, or maybe they have half an hour of relief after these treatments, but it just doesn't shift it. And I'm not crapping on any of these professions. I really value them. I really do think they're an important part of rehab. And based on, in my experience, they're missing this circulation, this cellular nutrient delivery, wastes removal component of this. So what happens is we start doing these injections and finally the chiropractor is like, oh, the adjustment's finally holding. And finally the massage therapist is like, oh, your tissues are finally feeling more supple versus resetting every time I see you. Finally the physio is like, oh, your range of motion is improving. The TCM practitioner says, oh, your pulses are different. So these injection remedies partner well with other therapies. And I encourage you, if you are experiencing any kind of daily chronic pain, to reach out because this might be an option for you that can turn the corner on these things because I truly believe that healthy, happy people doing what they love contribute to a more peaceful world, and I want you to be one of those people. And I also believe that health isn't something we do just for the sake of it, but it is a vehicle that drives us to all the things in life that light us up. For example, going back to this fellow that I was talking about earlier, hiking with his friends, getting up and down off the floor, tumbling around with his grandkids, running with the dog in the park, all of these things that make his life richer and happier, he can do now because of these therapeutic treatments. Look me up, NanaiMoIVtherapy.com. Under the services menu at the top, you can find pain recovery injections, and I'm happy to help.